I'm delighted to be joined by cardiologist Dr. Fahmi Farah. I hope I pronounced your name correctly, Dr. Farah.
It's Farah.
Okay, if I wasn't close, let me get it right. How's the pronunciation?
It's Dr. Fahmi Farah.
Fahmi Farah. Okay, fine. Okay, I made it a soft A. It's a Farah. Okay.
You're pretty close.
You're a cardiologist and a board-certified invasive cardiologist, and there's an alarming rise of super fit, slim young people suffering heart attacks as experts prevail theories for the surge. So the question is, when you think about people having heart attacks, as a rule, you think about older people, and you think about maybe older people who are carrying around a few too many pounds, maybe older people who are obviously overweight. The opposite of that, you would think, is this group who are young and in great shape. What's going on?
I think it's a result of multiple different things. I know that data that's come out recently shows that over the course of the last 5 years, the rate of heart attack has gone up by almost 41% between that age group, young population between 25 to 43 age. And the reasons, it could be the COVID virus itself that had caused some damage to the vascular system. I think there's more than one reason, though. I do believe stress is a factor. More and more people are stressed out for various reasons, job-related. Schedule is not as great. People are not sleeping well. Sleep is now considered a major risk factor by the American Heart Association. Also, a lot of people who are fit and gym-goers, they may be taking exogenous steroids such as testosterone shots, which are very common and very popular right now. They have testosterone shot centers. I don't know how well regulated these are, but the reason I bring this up is because there is an inherent risk of increased cardiovascular events as a result of testosterone shots. So that could be playing a role as well.
Well, why would I assume you're talking about young men in that situation? If I'm wrong, please correct me. But why would a young man who is working out and who is in obviously good physical condition, why would they even think about testosterone shots? I mean, I understand that there are people who have certain medical conditions later in life, and they may need to have a testosterone shot. But if you're a 25-year-old guy who's in a gym and you're in good shape, I would think you got all the testosterone that you need. Educate me, if you will.
You're absolutely correct. It's mind-boggling to think that a young male would take testosterone shots. But believe it or not, I am talking about the young population. And yes, testosterone shots have become very popular among young groups, not because they're low on testosterone, but because it's a very popular item to use for gym-goers, for example. A lot of personal trainers, they encourage them because it helps build muscle. So it is an exogenous steroid. It is something that helps people who are trying to build muscle, and it speeds things up. And so it has become a very popular thing to use among young folks.
Okay, so if you use testosterone shots to build up your muscle fiber, so you can press or lift a little more than you could, you're going to have to keep doing that, or that testosterone. You just can't take the shots. Once you start taking them and relying on them, you got to stick with them, I assume, if you want to maintain where you are. Correct?
That is correct, and it also has many side effects. One of the most feared one, of course, is the increased risk of cardiovascular disease and events like heart attack and stroke. But also, you're right, when you're giving something that you don't need, it does mess with your entire hormone system. The axis that creates natural hormone kind of gets messed up a little bit. It doesn't have that natural feedback system anymore. And so you can't really abruptly stop it. And when you do, it can have a lot of detrimental impact, and of course, taking it will have the same effect. It can affect all organ systems, including your cardiovascular, your neurological system. So it can have a wide impact on your whole body.
At what point should people who really want to take care of their heart? I know that cancer and heart disease are the two primary killers in this country. Um, Cancer, obviously, you now can do blood screening tests for cancer. I'm sure you're familiar with those. Um, and obviously, going to your personal care physician, your PCP, they can do all sorts of tests, and they can spot heart problems. Are we getting to the point where people who have the time and the financial support that people at a certain age, men maybe at one point, women at another, should incorporate a cardiologist into their annual medical test and routine?
Well, absolutely. I totally agree with that. And I'm a big proponent of preventative medicine. As you know, yes, cardiovascular disease is the number one killer for both men and women here in the United States, but it is also a very preventable disease. 80% of it is preventable if you come seek help on time. So, yes, for those who have risk factors such as high blood pressure, high cholesterol, diabetes, people who smoke, people who have a family history of heart disease, they are encouraged to seek help early on, at least get an evaluation by a cardiologist just to make sure that everything's okay.
Is there what I'm saying is there a time frame when people hit, we talk about cancer screening and we talk about prostate exams, we talk about breast examinations, mammographies for women. Is there, in your experience, a period of time in regular people's lives? If someone gets identified as having a problem in an annual physical when they're 35 or 40, obviously, but is there a point in time when people of a certain age, men and women, should not only be talking to their doctors about cardiac health, but should actually push to have a special cardiologist check on them every 2 or 3 or 4 years? What is the best theory? It sounds like someone's beeping a horn at you here. You okay?
I'm good. Yes. When it comes to, you brought up a very good point, actually. Like, for example, for cancer, there are certain age groups where we have specific time. Like, you get your mammogram. For colonoscopy at a certain age, you go get your screening colonoscopy, and that can prevent that thing. Unfortunately, there's not a defined age group for cardiovascular screening that's defined for all age group that, yes, at this age you're going to go and get your heart checked. That doesn't exist. In my opinion, it should. We do have things where we screen for risk factors during certain age groups, like, for example, your lab work, yearly lab work, where we're getting your cholesterol checked. Of course, every time you go to the doctor's office, blood pressure is being checked, and diabetes. But aside from those, like actual true cardiovascular screening and specific cardiac testing, no, there's not a defined age group that regardless of where you're at this age, you're going to go and get your heart checked. Unfortunately, that doesn't exist, and that is something that we need to work on.
Well, maybe we can start a conversation. Thank you so much for your time tonight on a Friday night, Dr. Farah, and love to have you back periodically just to emphasize to people what clearly should be obvious, and that is the importance of their heart health. Thank you so much for your time this evening.
Thank you. It was my pleasure.